Andy Johnson. We are looking at marijuana and mental health. Some facts and figures. 2014 study of adolescents who were current users of marijuana, the percentages. 12 to 17-year-olds, 7.4%, 18 to 25-year-olds, 19.6%, and 26 and older, 6.6%. Marijuana is the most common illicit drug used. Now, this is concerning for adolescents and pre-adolescents because it affects the developing brain. Effects on cognition or thinking. Now, marijuana does not enhance creativity, contrary to common thought. You may perceive that to be simply because you are more relaxed, but as measured by divergent thinking or the ability to generate a whole bunch of different ideas, marijuana has been shown to actually reduce creativity, as well as disrupts the ability to test reality, reason, control impulses, set priorities, relate to others, etc., etc. Effects on the neurocognitive function, well, deficits in processing speed and working memory. Short-term memory is impaired, and people have been found to have difficulty tracking conversations as the information becomes more complicated. And the sense of time is altered, meaning that you tend to do things more slowly. The long-term effect related to adolescents' use of marijuana, it has been correlated with poor educational outcomes and a reduction in IQ as measured by IQ tests. What about the effects of on motivation? Motivation has been shown to be adversely effective. It affects the dopamine, that chemical that rewards you for doing things. It's found that students, all people, the same activities are not as reinforcing. It is associated with a general sense of malaise, especially with adolescents. Now, compared to alcohol use, marijuana users have lower energy and motivation levels and perform lower on measures of school performance and job performance. Look at medical marijuana. Now, today, the potency of marijuana has increased substantially in the last 20 years. In 1995, the THC levels were less than 4%, and today they are greater than 12%. Now, there is high-quality evidence to show that people do get relief from the following. So pain relief is limited to these three conditions: severe pain syndrome, neuropathic pain, and we'll look at that in just a minute, and spasticity due to multiple sclerosis. Now, neuropathic pain is chronic pain accompanied by tissue damage, and it could be related to or as a result of any one of these conditions right there. The thing we have to consider, however, when we look at marijuana and medical pain is there still are many questions related to research, methodology, and use. It's hard to have experimental and control groups and double-blind effects, and many of the studies have small sample sizes. So all the research that I'm showing you, or the information I'm showing you, which is a result of research, should be taken with many grains of salt. There are as many questions as there are answers. Let's look at marijuana and some mental health disorders. Moderate to heavy use can worsen some conditions: post-traumatic stress disorder, anxiety, and depression. Now notice how this is stated: can worsen. It doesn't say it definitely leads to worse conditions. This is how research is generally stated. There are very few universal truths when we are looking at research. Profound marijuana use in adolescents results in have been shown to moderately increase the risk for depression later on, at a greater risk to develop major depressive disorders. However, marijuana may have some positive effects on adult anxiety disorder. This is anxiety disorder with adults. However, the research is far from conclusive. So I don't want to come down on one side or the other here. Hopefully I will present, or I am presenting, a balanced view of what I believe or what I have found to be the facts on marijuana and physical and mental health disorders. Marijuana use and comorbidity. Now, comorbidity is one medical condition, one or more medical conditions existing simultaneously with another medical condition. All right? There are morbidity issues with marijuana. However, there is little research to support marijuana as being a gateway drug. That means more apt to lead to hard drugs. Now, marijuana use typically follows drug use and then precedes illicit drug use, but you cannot say it's a gateway drug because correlation does not infer causation. The people who tend to use marijuana tend to be the kind who would be more apt to use hard drugs, illicit drugs, or other drugs, or have access to these other drugs, or have a propensity for this other drug use. So you cannot say that it's a gateway, that it causes or leads to. That link has not been made. Some of the social detriments to marijuana use: early marijuana use is associated with poor educational outcomes and higher school dropout rates. However, these results may be confounded by mental health issues, poverty, adverse childhood experiences, and social exclusion, meaning that the poor educational outcomes and higher school dropout rates could be related to these other issues. We cannot say that marijuana caused poor educational outcomes or higher school dropout rates. These confounding variables may as well have led to these things. Marijuana use, anxiety, and depression. There is a strong comorbidity between marijuana use and depression and anxiety disorders. But again, we don't know if it's cause or effect. Do people with this diagnosis seek out marijuana, or does marijuana lead to these conditions? A causal relationship has not been established. What has been found is, in many of the studies, is that marijuana is a coping mechanism for anxiety disorders. People who use marijuana had 4 times greater rates of depressive symptoms, especially suicide ideation. That means you are thinking about suicide quite a bit. And again, correlation is not causal. Marijuana has not been shown to cause these things. There is some evidence to support the consideration of marijuana for anxiety disorders. However, again, I must stress that more research is needed. Treatment of marijuana addiction. Half of daily adolescent users are likely to become dependent. DSM-5 lists cannabis as one of the substance use disorders. 2006 study with 600 adolescents with marijuana use disorder found this comorbidity. 77% had ADHD, 74% conduct disorder, 38% had depression, and 29% anxiety disorder. And this is not causal. We don't know which came first. We don't know if this is a coping mechanism or if marijuana led to these things. The research is far, far from conclusive here. However, they did find that treatment of recurring mental health disorders improves the likelihood of reducing or abstaining from marijuana use, meaning that we treat these current mental health issues and people are more likely to abstain or reduce their use of marijuana. In the same way, marijuana creates a barrier to treating these mental health disorders. So it's a two-way kind of thing there. All right, I probably raised as many questions as I answered, but this just looked at some of the salient issues of marijuana and mental health.